Lawmakers are just a few days into the second session. One item that will be discussed in Augusta in the coming weeks is the concerning rate of nursing home closures across Maine. The Maine Long-Term Care Ombudsman Program says there is a need for further legislative action to address this trend. They hosted a call to action alongside the Maine Healthcare Association, North Country Associates, and Maine Health with lawmakers this week to share some updated statistics. Since 2014, 23 nursing homes have closed across Maine. 9 of those closures have occurred since the start of the pandemic. Last month, Maine DHHS announced it was issuing $19 million in one-time Medicaid payments to about 80 Maine nursing facilities. While that money will be used to support continued recovery from the pandemic, Angela Westhoff from the Maine Healthcare Association says it's not enough.
Historically, there's been a significant shortfall between the cost of providing care in nursing homes and what the state has reimbursed through the Maine Care program. And that cost of care differential is about $40 a day. And last year, with the as-filed 2022 cost reports, the shortfall was actually $96.5 million. So $19 million is a good first step, but it doesn't certainly close that whole gap. There have been some additional other one-time supplemental monies that have helped, but we have sort of this chronic problem of underfunding.
Westhoff says they will be holding an event next Thursday, January 11th, in the Hall of Flags at the State House. They will also be testifying on a number of bills this session.